Hello, Caribbean.
I am Dr. Adrian Rhudd.
I'm Dr. Dalano DaSouza.
Here with Dr. Leon Stevens.
I'm Dr. Leslie Walwyn.
You're watching Caribbean Medical TV.
Caribbean Medical TV.
Caribbean Medical TV.
Caribbean Medical TV.
Welcome to all of our viewers within the Caribbean and beyond. I am Dr. Alafea Stevens with a background of emergency medicine here in Antigua and Barbuda. The foundation of medicine is chronicled with great revelation, from the modernization of antibiotics, the understanding of transmission of diseases, the invention of the MRI, our first organ transplant, and the use of artificial intelligence within medicine. These are just some of the great accomplishments within medicine, and there are many more to come. Those of us today have a significant legacy, not just to reflect, but to build upon, and for future generations to strengthen. Here at Caribbean Medical TV, we bring these insights to you. This is our world, our future. This is Caribbean Medical TV.
I teach the art of medicine, how to take a history, how to examine patients, as well as global health. So at the American University of Antigua, we teach first and second year medical students the art of taking a history and examining the patient. And a huge component of what we do in the global health component of the school's curriculum is based on the health impacts of climate change. I think, though, we still have difficulty getting population data. Not enough research happens in our region about our health as a people, especially with the changes that our population has been going through with climate change, the increased amount of non-communicable diseases that we have. We have very limited data. So within an island, we're not necessarily getting the information we need to help us make policy decisions at a higher level. And then within the region, we're not necessarily knowing what all of the other islands are doing as well. So we need more research to get more data. And we need to be transparent with our research. Share the information. So when we gather the information, when we do our research, don't hold it close to your chest. Share it. Growing up in the Caribbean, I think one of the things that, as a small island girl, lived at the beach on the weekends, one of the most easily visible things where I feel like I am the reality is really there and it's seeping in slowly, is all of the sargassum on the beaches, all of the seaweed on the beaches. This beach on the west side, beautiful. The east side, almost the exact opposite. And that has affected the lives of fishermen, that has affected the lives of residents, because the scent of the rotting seaweed has impacts on our health. So if we just look at the increasing environmental temperatures, it's hotter outside on more days of the year, and we have more heat waves than we've had before. The United Nations used to say, in order for us to stay alive, we cannot increase our temperatures of the environment beyond approximately 1.5 to pre-industrial ages, or else, pardon the expression, all hell will break loose. Well, we've gone past that 1.5 degree. We're at approximately 1.8 degrees, just heat alone. If you have a few days where it is excessively hot, when we're having a heat wave, that can cause heat exhaustion, especially for the extremes of age, the very young, children under 1, and persons over 65. Add to that, persons over 65 often have chronic diseases holding their hand as well. So they'll have hypertension, diabetes, lung disease, cancer, etc., which only makes the consequences of that external shock of the heat harder on their body. And unfortunately, even though we're accustomed to heat as Caribbean people, sometimes it's too much, especially when we're older. As we get older, it's harder for us to thermoregulate, to keep our internal temperature at an ideal temperature. So we lose that fine-tuning of our organ systems to keep cool. And And two, we're often on medications that will add to the challenge of keeping cool, and therefore we end up more likely hospitalized. Luckily, in Antigua, and I'm sure in other islands, you have alerts on the radio, alerts on TV, alerts on social media. There's a merging, finally, of environmental awareness, the meteorological information merging and complementing health advisories, and that's critical for us right now. From my health perspective, from my health lens, I really do ask myself, are there things that we need to rethink? So these are all important considerations when we're looking at things from a panoramic view that we should really take into consideration. Another example, you're elderly, you're retired, you're working on the income that you earned years before, so you have a fixed limited income. You might have an air conditioner in the room, but you said, I don't want to use it because I don't want my electricity bill to go up. And what happens to me? Heat stroke. One of the things that I advise my patients to do is identify your cool spot. Is your cool spot like where we are right now, where the breeze is blowing and you're cool? So do you have some shade under a tree that you have a bench so that in the hottest parts of the day between 1 p.m. and 4 p.m., you're cool and you're relaxed? And of course, stay hydrated. Pregnant women, another very precious category of persons who are very sensitive to the impact of climate change. They have a whole new little human being growing inside of there, which also cannot tolerate the changes in the external temperature. So we as healthcare practitioners also have to weave in climate change in our data processing of a patient so that we ask climate sensitive questions, all right, and examine our patients with that in mind, and so that we too can counsel our patients appropriately to prevent that exposure as best as they can. Melissa was tragic, scores of deaths, tragic loss of infrastructure, people losing their homes, people losing their roofs, people not having adequate access to healthcare post-event. And post-event, all of the health consequences that ensued. I know that there were smart hospitals that were built in Jamaica where they deliberately went in to make hospitals that would be resilient to adverse weather events. So they're building smarter hospitals. That's a great thing. So building hospitals that can resist these extreme weather events, that's important, that can withstand a Cat 5 hurricane, that will have a water supply and an electrical supply thereafter, that are green and producing less energy. And then on top of that now, we have a response system, a tertiary care response system. So you have, when one island is impacted, I know Barbuda has gone in to other islands. It went in to help with Melissa. And you have a field hospital that can add and ensure that healthcare needs are actually met in this acute post-disaster phase where the demands are extremely high. And from a health perspective, making sure that you do check regularly to see how well you're doing, and that we as practitioners do the best by our patients by ensuring that we give them the best possible care under this new world that we're living in. I would love for all of us to do, while all of us continue to fight for the necessary global economic changes to occur to reduce the threat for us.
My name is Dr. Dalano DaSouza. I am a lecturer in economics at the University of the West Indies 5 Islands campus in Antigua. One of my focus areas of research is health economics, health financing, and health insurance in the Caribbean. One of the things that we've realized in the Caribbean is that funding healthcare is very expensive. I mean, that's the case globally, but unlike in places like the US, for example, in the Caribbean, the governments have undertaken to primarily fund healthcare. That's the model. We've been working for a long time to get to universal health coverage in the Caribbean. The governments have undertaken, most of the Caribbean governments have made it their policy position to fund healthcare insofar as they can afford to. And so because of that, it's created a unique situation, for example, where private health insurance hasn't grown to the extent that it has in other places like the US, for example. So in Caribbean, there's a dependence on publicly funded health systems. And that really means the national hospital and the system of polyclinics or clinics that sort of operate throughout the different countries. So when you go to the hospital, the fees, the tests, they're heavily subsidized by the government. So they really don't represent the cost of what those procedures cost. And because of that, it creates funding gaps and funding deficits for the government. It's very difficult to fund the healthcare in our space, generally. And because of that, it invariably creates, for example, long lines. It takes a long time in terms of processing, in terms of getting back test results, even in terms of the requirement for persons to spend extended time at places like the hospital and the public system. The reality is, when you look at it and you say, well, why should the government be helping persons or paying persons a part of a person's health insurance premium? The reality is, the healthier people are, the less they end up in the hospital, and that's a point in time when it costs the government more when they're sick. A sick population costs the government, and these are the things that we look at in health economics. When your population is sickly, it means that they're calling in sick to work more often, so productivity in the country tends to reduce. It means that even when they're on the job, they're not feeling well. Yeah, it means that their lifespans are lower, are shorter, which means now you have to continuously, and then you end up with a population now that we're seeing where we have a large youth population, and in some instances now we're seeing that we have a large elderly population, but they're sickly. They're living longer, but they're sickly. From what we see, I think we still have challenges in terms of getting persons on board. We need a lot more campaigning in terms of healthy lifestyles from your toddler. And I think that's kind of where we need to start. We need to have healthier children. Healthy children grow up to be healthy adults. And we need to start to inculcate those sort of healthy habits within our kids as they grow. And it's a challenge. I mean, even if you look, and I used to live in Barbuda before I moved to Antigua, one of the debates that they were having is in terms of, for example, the national sporting events for secondary schools, where they had high sugar content juices and businesses sponsoring those events. That became a talking point, because on the one hand, you can't be saying you want healthier kids, but then the events you're promoting these sort of unhealthy foods as well. I mean, it was a big thing when they decided they were going to alter the school meals. I know there are conversations ongoing about regulating, but now, there's at the gates of the school, for example, where the children come out and they buy things at the gates. They have vendors there selling, and so that's a conversation now. Because ultimately, it starts with our kids. It starts within the home. And it's a broader conversation, because at the end of the day, sometimes the reason why kids are being fed what they're being fed is that they can't afford to eat healthier. Their parents can't afford to give them the more nutritious meals, for example. And so that kind of overlaps with other economic issues in terms of income and so on. But the reality is we have to start in the homes. We have to wean ourselves off the dependence on high sugar content and high salt content and so.
Thank you to my fellow colleagues within the region. Your dedication exemplifies what we can accomplish once we work together within the Caribbean region. Trust that every day we grow stronger through knowledge, compassion, and unity. Stay tuned. We'll be right back.
Hello, I am Nigel Batiste, Group President and Chief Executive Officer of Republic Financial Holdings Limited. The Republic Group has always prioritized the holistic development of the communities and countries we serve. It's a mission driven by our flagship Power to Make a Difference corporate social responsibility program and the dedication of our staff, where we focus on 4 key pillars: the power to learn, the power to care, the power to help, and the power to succeed. For us, this is just the beginning of our sustainability journey, and we remain fully committed to unlocking financing to support the attainment of the United Nations Sustainable Development Goals, which ultimately would lead to a Caribbean region that is safe, healthy, and sustainable for many generations to come.
The small island developing states face unique climate and health challenges. But as a society, there is a truth shared universally. We are not alone in our challenges. The key to the solution is constant dialogue that spans borders. For the health of the individual starts at home. It starts with the men and women of all island communities. And today, we bring that awareness to you.
I'm glad to be here on Caribbean Medical TV, and I'm an advocate for men's health. As we all know, men's health just is not where we would like it to be. The life expectancy of men has lagged behind women for decades and centuries. It's very complex. Also, we deal with a different set of diseases which affect our men, particularly in our population in the Caribbean. 1 in 6 of our black men will get prostate cancer. Unfortunately, where we are now, based on medical science, we have no way to prevent this. Luckily, things like cervical cancer are actually preventable. We can actually eradicate cervical cancer with that vaccine and early detection. But with prostate cancer, there's absolutely nothing we can do other than detect it early and treat it early. So the prostate is a gland that sits just in the pelvis, behind the pubic bone, just in front of the rectum, just below the bladder. It's not very easy to access. Urine flows through the prostate, out through the penis, and out of the body. The prostate produces secretions which are helpful to liquefy the semen and create a friendly environment for your sperm to fertilize the egg. That's the whole purpose of what it does and where it is located. But for reasons which we do not know as yet, cancer cells can grow in the prostate. So cancer cells are essentially cells which choose to not obey the normal start and stop signals. Cancer cells do whatever they want. They grow, they grow, they grow, they grow, they spread, they move to areas where they should not be, and that ultimately causes death in the patient. Compared to breast, a woman can see a lump on their breast, but you cannot see your prostate, you cannot feel your prostate, and unfortunately, you only have symptoms when it is advanced. Things like blood in the urine, difficulty peeing, weight loss, back pain, leg weakness, that's a sign of advanced prostate cancer. Early prostate cancer has absolutely no signs or symptoms, and that's why we strongly push the men once a year, get out there and get screened with a digital rectal examination and a PSA, prostate-specific antigen, a blood test. Any PSA above 4 is abnormal. All men, once they hit 40 years of age, go and have that PSA test done. Anything above 4, see your urologist. It's not a perfect test. There's a gray area where we may interpret the numbers in light of other things happening. If you are 40, go and get tested once a year. Around the time of your birthday, go and get that checkup. And remember, you're more than a prostate. Use it as an opportunity to check your prostate and check for the other illnesses which affect our men in our population. Most men do not talk about feelings. They don't want to be perceived as sick, as weak, as vulnerable. So very often once a diagnosis is made, they like to hold it close to the chest. I'm very encouraged by very prominent men coming out in the public eye and telling people about it, telling people about their journey. It brings awareness and gets other men coming out. Just the other day, one of the ex-president of the United States. So it shows that this thing can happen to just about anyone. It is also so common that I think most men over 50 know someone who has had it. So I'm pleased that the discussion is getting out there. People can question it. The good thing is, so after prostate cancer is diagnosed, we then have to stage the cancer to find out how far has the cancer gone. Is it only in the prostate, or has it spread outside of the prostate, around the prostate, or in the pelvis, or to bones, or to other organs? If it is confined only to the prostate, you have an excellent chance for complete cure and to live 10-15 years. That is when we would like to catch prostate cancer. If we pick it up late where it has spread outside of the prostate, things are not so good. But where you would like to catch prostate cancer is early in the prostate, before you have any complaints or any symptoms, because that gives you the best chance for a complete cure. So one of the worst things that can happen, or certainly I witness in my practice, is when prostate cancer spreads to the bones, damages the vertebra, the spine, and causes collapse and paralysis. For a patient to be unable to walk and bedridden is very debilitating. And you see that in stage 4 advanced cancer. I believe that with what we're doing here, advocating, encouraging, we should never see it. But unfortunately, we still do see it, and there isn't much that we can do for it. In cases where patients have access to spine surgeons, they may be able to do emergency surgery, spinal decompression, and salvage the patient. But very often the diagnosis is picked up late, the patients present late, and there isn't always access to spine surgery. So it's one of the things that we hope to never see, but we do see a lot more than we should. Another thing you should not discount is the women. The women take the message home to their husbands, to their brothers, to their fathers, because men will bury things and keep and suffer in silence. The women will get out and say, go and get checked, go and get checked. I have women that give their partners gifts to come and see me as a birthday gift for their checkup, and I'm very encouraged by that.
Women's health has been something that has been the cornerstone of not just Antigua, but in the Caribbean. One of the main things I've noticed in the Caribbean that women's health has been ignored over the years, and women's health is very important. Here in Antigua, one of the major things I've found over the years that I've been working there is the number or the prevalence of which we actually have of uterine fibroids, persons coming in with abnormal uterine bleeding. I'm pretty sure everyone in the Caribbean, black, white, Asian, different race, everyone at some point in time has to deal with uterine fibroids and, if not that, some sort of abnormal uterine bleeding. One of the major things that I actually see a lot is that young women, older women, they're at work and they have issues with bleeding. Some women even are embarrassed to be able to actually talk about this. We deal with it on a daily basis. And many a times we try to go as far as medical management, where we can actually give you medication and have a regimen in which we can actually treat the symptoms. Some do resolve with that, others resolve in surgical intervention, which is another part of our job description. Many patients do always ask, Doc, can fibroids cause cancer? Fibroids generally do not cause cancer. It's a very rare possibility for that. But nevertheless, we always send our samples and we do our testings to make sure that rare possibility doesn't present. And I'm always happy to extend my help, not just to patients alone, but to the family, because even the males don't fully understand the situation. And a woman who has a partner needs to have a partner so she actually is on the same page with her. Because most men, they will say, no, that's a woman's problem. It has nothing to do with me. Very far from the truth. I'm always of the opinion, as I said, we need to come together as a family. And the key is education. Once you educate your patient, what are the signs and symptoms to look for, then I think they'll be able to mitigate whatever the situations may be. Globally, our rise in cancers have been exponentially increased within the past 30, 40 years. If it is that you're having symptoms that should not be, go to the doctor. Do not be afraid. Back in the days, I know we would be afraid to go to the physician because everyone is afraid of an injection. There's a patient of mine who came. She's like, Doc, I've been having bleeding for the past 5 years. I'm not seeing my cycle for the past 10 years. But it's my sister or my neighbors who told me to come and seek medical advice. We took a biopsy. It actually was cancer. She was lucky, one of the lucky ones who were actually able to get it early and treat, and she's still alive up to now. There are not so many persons who had the same fortune. Your mom, she may be saying, you know what, I'm having this pain in my belly for the longest while and I've been bleeding, but you know your mom is no longer having her cycles. Carry her. Sometimes you need that extra push, someone to go with them, someone who they know. Because when they sit down in a physician's office to get all that news at one time, it's overbearing, it's overwhelming. When you have someone there with you to guide you through, it makes it a lot easier. That little step that you make to just seek medical advice goes a very long way. And there's no limit, there's no price on your life. Your life is very precious. We deal with both life and we deal with both transitioning of life to death. A lot of persons don't like to hear the word cancer, but it's something that you should not be afraid of. You want to prevent these things before it escalates further. And if it is we continue doing that, I think we can actually improve our healthcare service in the Caribbean to be a first world-rated healthcare. It's just that everyone needs to play their part. Physicians play their part, the governments play their part. Individuals, patients also play a crucial role, because if it is they don't go and seek healthcare advice, we would never know. So we're no longer just the doctor that come to that writes the prescription. Sometimes you spend hours with the patient sitting down just to have a conversation, just so that you can hear what their history is. And many a times, before you even do anything, they say, Doc, honestly, I feel better just by having this talk, because that one-on-one, it's priceless.
Thank you, Dr. Stevens, for highlighting how important those conversations are. As members of the small island developing states, the work towards renewed focus on promoting healthy, prosperous, resilient economies through renewable energy, digital transformation, and sustainable ocean management is only the beginning. To change the outcome, we must engage the individual, our friends, our children, our mothers and fathers. Our home has always been a foundation to build upon, and the calling is here now to protect the Caribbean and her people. Join us in walking towards that change.
We hope you enjoyed this edition of Caribbean Medical TV. As you can see, we are front and center with healthcare issues within the community and the Caribbean region. We would further like to let you know we are committed to bringing you a healthier Caribbean and a healthier you. Stay tuned for upcoming episodes here on Caribbean Medical TV.